Few people know this, but the health of your entire body, from your skin to your brain, depends on this organ. And almost no one knows how to actually help this organ. I'm talking about the liver. In this video, I want to tell you what really ages our liver, why some medications in your home medicine cabinet can be dangerous, and what you can do to help your liver recover. Be sure to watch until the end, and I'll show you exercises that will gently restart your liver. I'll also tell you which supplements can support it. But before we start, I want to mention that unfortunately, 70% of my viewers watch my videos without subscribing, which prevents them from being recommended to others. And that means many people won't see this video and won't be able to help themselves. So, if you find this video helpful, be sure to subscribe, and I'll keep bringing you useful and valuable content. Alright, let's get started. The liver is an organ that carries an enormous load. But what wears it out the most? The first and most important thing is inflammation. It can be caused by viral hepatitis, fatty liver disease, or chronic infections. Inflammation destroys liver cells, hepatocytes, and triggers aging processes. The second factor is toxins. These include alcohol, certain medications like acetaminophen, food toxins, and preservatives. Yes, that's right. Acetaminophen is a frequently underestimated enemy. In large doses, it is dangerous. And when combined with alcohol, the toxic load increases dramatically. It's effective, but in case of overdose, it can cause liver damage. In addition, the liver suffers from frequent use of non-steroidal anti-inflammatory drugs, antibiotics, and some cholesterol-lowering medications. So, let's figure out how to tell if your liver is already suffering. After all, unlike the heart or stomach, the liver doesn't hurt. It simply doesn't have pain receptors. That's why it's very important to know the indirect signs that may point to this problem. And the first sign is chronic fatigue. If you constantly feel weak, get tired quickly, and don't feel refreshed even after sleep, this could be related to impaired liver detoxification function. When it's not working at full capacity, metabolic byproducts build up in the blood, and you feel this as fatigue. Second is a deterioration in skin condition. Dryness, itching, rashes, redness of the palms, and spider veins on the body. All of these can be signs that the liver is overloaded, especially if yellow spots appear around the eyes or the skin darkens in the armpit area. Third, digestive problems. Nausea, especially in the morning, heaviness after eating, loss of appetite, and bloating. All of these can also be related to bile stagnation or metabolic disturbances in the liver. Fourth, changes in the color of urine and stool. This is a serious sign. Urine may become dark, like tea, while stool, on the contrary, may become very light or even colorless. These are already signs of possible bile flow obstruction. Fifth, changes in mood and cognitive functions. The liver plays an active role in neurotransmitter metabolism, and its overload can even affect brain function. And finally, yellowing of the skin and eyes. This is already a serious warning sign that requires immediate examination and often hospitalization. Even a slight yellowish tint of the sclera is a reason not to postpone a visit to the doctor. So, what can happen if you ignore these signals? If you don't pay attention in time to fatigue, skin symptoms, or digestive problems, liver cells begin to break down. At first, this is steatosis or fatty degeneration. This is a condition where fat accumulates in the liver and metabolism is disrupted. If nothing is done, the next stage is called fibrosis. This is when the tissue starts to scar. The body tries to compensate for the inflammation, but in place of the dead cells, connective tissue forms, which doesn't have the same function as the liver. Fibrosis can be reversed, but only in the early stages. And if a person still doesn't take any action at this stage, cirrhosis of the liver develops. This is a very severe and already irreversible condition. The liver essentially loses its structure. The number of functioning cells decreases, detoxification, protein, and hormone production are impaired, and the immune system suffers. Ignoring the liver's warning signs means risking not just your health, but your life. And what's especially frightening is that until the very last moment, a person can feel absolutely fine. But there's one catch. The liver is different from other organs. It has a truly unique ability to regenerate. Its cells renew faster than any other cells in the body. This means the liver doesn't need to be cleansed. It just needs to be left alone to heal itself and given a little help. Let's figure out how we can help our liver. First, nutraceuticals. Milk thistle or silymarin protects and restores liver cells. Alpha-lipoic acid is a powerful antioxidant. Omega-3 fatty acids also help the liver and reduce inflammation. Let's not forget about B vitamins. They are involved in the metabolism and regeneration of the liver. Our favorite curcumin has anti-inflammatory properties and is very important for maintaining liver health. And of course, don't use nutraceuticals on your own as self-medication without a doctor's prescription or even seeing a doctor. This is support, not a replacement for proper treatment. If you want to really understand what's wrong with your liver, here's a list of tests you can take. ALT and AST show liver enzymes and increase when there is damage. GGT and alkaline phosphatase indicate the condition of the bile ducts. Bilirubin is an indicator of bile metabolism. A complete blood count and a coagulation test show how well the liver is functioning. Additionally, your doctor may refer you for a liver ultrasound or a fibroscan to assess fibrosis, as well as tests for viral hepatitis. And one more thing, the liver is an organ that is very sensitive to congestion. It likes movement, but it's important to understand that if your liver is already overloaded, which can happen with steatosis, fibrosis, or chronic inflammation, you absolutely should not put strain on your abdominal area. This can worsen blood outflow, trigger pain, and make the condition worse. Choose gentle, rhythmic exercises that help the liver rather than hinder it. And now I want to show you 4 simple exercises, each of which targets a specific mechanism in the body. The first exercise is twisting while kneeling. Get on all fours, extend one arm forward, and with the other arm, reach under your armpit, trying to twist as much as possible while staying in this position. Return to the starting position and repeat the same movement on the other side. This exercise is aimed at improving lymph and bile flow. When you twist, you gently massage your internal organs, especially the liver and gallbladder. This helps bile move more easily through the ducts, reduces stagnation, and lowers the risk of stone formation. The movements should be slow and coordinated with your breathing. Inhale as you extend your arm forward. Exhale as you twist. Do 10 repetitions on each side. The second exercise is called the palm. Take a breath in. Exhale, slightly bend your knees and twist your torso. Do this exercise 10 times on each side. This exercise activates internal blood circulation and venous outflow. The liver filters blood around the clock. If blood flow slows down, its efficiency drops sharply. Smooth movements with a gentle twist of the torso softly shake up the internal organs, as if speeding up the flow of blood and lymph. The third exercise is brisk walking. It's probably the most underrated and one of the best exercises for the liver. When you walk, the muscles of your legs and pelvis are engaged, improving blood outflow from the lower part of the body. This reduces the load on the portal vein of the liver, the main highway for venous blood. In addition, regular walking reduces visceral fat, which is primarily deposited in the liver. Start walking for at least 30 minutes a day, especially in the morning, and you'll feel how your well-being changes. As I mentioned before, the liver is an organ with a unique ability to regenerate. But it doesn't need to be cleansed, it needs to be supported. Share this video with your loved ones, because the liver doesn't hurt, as they say, until it's too late. And prevention is the best way to protect your health. This was Dr. Dlin with you. Take care of yourself. See you next time.